Okay, so I've already introduced myself, washed my hands, and I've checked my patient's wristband. So I've made sure I've checked 2 patient identifiers to make sure that Anna is who she says she is. And before I administer the medication, I'm going to ask her a few questions. Hi, Anna.
Hi.
So, can you tell me if you take any prescription or non-prescription drugs currently?
No, not taking anything.
Okay. How about any herbal medications?
No.
No. Have you ever experienced any side effects from past medications that you've taken?
Nope.
Okay. Do you have any allergies to medications or to any foods?
No.
Do you have difficulty swallowing at all?
No.
What questions do you have about your medications? Do you have any questions at all?
Nope. No.
Okay.
No questions.
And are you experiencing any nausea or vomiting at the moment?
No.
No, okay. How about any recent surgery? Have you had any recent surgery?
No.
Okay. Okay, so that's good to go. All right, so I will get started right away by reviewing the healthcare provider's orders. Okay, so I will make sure here that the medications that I have are the medications that are prescribed. So 200 milligrams of ibuprofen or Advil to be swallowed orally once a day at 9 p.m. So right to medication. So I'll start off by observing the first 6 rites of medication administration. So checking the right medication, ibuprofen, checking to make sure it's the right client, Anna, with 2 patient identifiers, ensuring the right dose, so 1 tablet of 200 milligrams, the right time, so 9 p.m. once a day, the right route, so to be swallowed orally, the right reason for headache and pain, and the right documentation, which I will do after I administer the medication. All right, so I will start off by preparing the drugs now since I've already washed my hands. So just starting by unlocking the medication dispensing system, selecting the correct drug, and comparing it with the MAR, which would be my first check. So ibuprofen, perfect. Advil, so checking the expiration date, it's not expired. All right, so now I'm verifying the correct amount. So 1 tablet of 200 milligrams. So I'm going to open it up and pour it into the lid without touching the medication. Okay. So each tablet is 200 milligrams, and that's what's prescribed, so there's no further calculation required. So I'm going to place the tablet from the lid into the medication cup now. So there's no pill crushing or splitting required either. So now I'm going to do my second check. So compare the MAR a second time with the prepared drugs. So once again, checking to make sure that it is the correct medication. Looks good. And I'm going to read the label again just before giving the medication. So once again, just ensuring that I have the right medication. Okay. Oops. Okay, so I'm going to label the medication cup with Anna's name before I leave the medication prep area, just to make sure that I don't leave it unattended. So I'll make sure her name is on there. Okay, so now to administer the medication, I'm taking it to Anna at the correct time, so it's 9 p.m., which is when she should be taking the medication. And I'm going to, I checked her wristband at the beginning, I'm going to identify her again using 2 identifiers to make sure that it is the correct patient. So, hi there, Anna. Can I take a look at your wristband again?
Yeah.
Can you tell me your first and last name?
Anna Montebello.
Okay, and how about your birth date?
September 27th, 83.
Okay, perfect. Looks good. Okay, and then I'm going to compare it to the MAR third time, so that's my third check. So once again, making sure that her wristband matches the information on the MAR. Looks good. So I'm going to go ahead and explain the medication's purpose and action to her to make sure that she's informed. So Anna, you're going to be receiving ibuprofen today, which is used to relieve headache and pain. So it's a non-steroidal and anti-inflammatory and analgesic medication
Okay.
used to relieve pain as an antipyretic.
Okay.
Okay, so do you understand the use? Do you have any further questions at all?
No questions.
Okay, perfect. Okay, so before I administer the medication, I'm gonna check her pulse and her blood pressure.
Okay.
So just checking your pulse here.
Okay.
Okay, pulse is 80.
Okay.
So it looks good, and your blood pressure as well. Okay, so blood pressure is 120 over 80, so that's perfect. All right, so you're sitting upright, so you're in a good position, and now I will administer the medication with water. There's no food needed, just water. So we
Okay.
have a glass of water.
Okay.
Are you good with holding the medication cup and placing it into your mouth?
Yes.
Perfect. Okay, so there's the water, and there is the medication cup.
Thank you.
All right, when you're ready, perfect. And can you open up your mouth and say ah? Perfect, it's all gone. Excellent. All right. So I've made sure that she's taken the medication, and now I will dispose of the medication cup appropriately. And then I will perform hand hygiene. So washing my hands again, and then I'm going to evaluate the patient's response. So Anna, how are you feeling since
Good.
you took that medication? Yeah, you
Pretty
feel
good.
good?
Yep.
Okay. All right, so you will be getting probably another dose of that again tomorrow at 9 p.m.
Okay.
Once a day, and then you can let us know if you feel any difference in the pain before that time.
Sure.
And now I will document, since I've given the medication, I will document exactly what was given, how it was given, what time it was given, and I will write all of the information down into the documentation book. Okay, do you have any further questions for me, Anna? No. No? Okay, perfect. Thank you very
Thank
much.
you.
Thanks.